One person's braveness and act of being open to new technology, what a huge impact had on millions of people all around the world.
I'm Dr. Louise Messara. Welcome to Season 4 of the Future Health podcast, Future Proof, a podcast about the future ways we will work, the work we will do, and the impact of technology and scientific innovation on the future of the healthcare industry. We have a fantastic lineup of guests this season as we cover topics ranging from life-saving cars to robot lawyers and even diagnostic t-shirts. So go ahead and like, share, or subscribe now so you don't miss a thing. You've just started a multidisciplinary meeting, or maybe you've just grabbed a moment in the tea room to wolf down a sandwich, or maybe you're just about to commence a sterile procedure and you receive an alert to respond to a patient emergency. People watch you as you sprint down a hallway, a human ambulance, to assist an unresponsive patient somewhere in the hospital. A MET call, code blue, or rapid response, as these events are commonly termed, requires a small team of trained professionals to rush to the bedside and provide reactive emergency support, often CPR, to a patient who is already under the care of a clinical team in a hospital setting. As impressive as the care provided may be, restarting a heart that has stopped in a hospital bed could be said to be emblematic of a health system that is, at its heart, built around responsiveness instead of prevention. Today, we're going to speak to one of Australia's leading researchers in nanotechnology about a future where the health system is so sophisticated that it can be predictive and not just reactive, and the impact this sort of transformation could have on wellness, diagnosis, and chronic disease management. Are we 2, 10, or 20 years away from wearing a device that will diagnose a heart attack before it happens? Let's find out. I'm Dr. Louise Messara, and this is Future Proof. Associate Professor Nasiri is the head of the Nanotech Laboratory at the School of Engineering, Faculty of Science and Engineering at Macquarie University. She's one of Australia's 2021-2022 superstars of STEM, which is science, technology, engineering and mathematics. She was the 2021 40 Under 40 Most Influential Asian Australians and the recipient of the 2023 New South Wales Cancer Institute Fellowship, the 2022 L'Oreal UNESCO for Women in Science Fellowship, and the 2021 Royal Society of New South Wales Warren Prize, as well as the 2019 New South Wales Young Tall Poppy Science Award. Very impressive. Her research is focused on design and fabrication of nanostructured materials, miniaturized sensor technologies, and wearable electronics for personalised and preventative medicine. She is a passionate science communicator who has received considerable outside recognition for her research, and if you haven't seen her TEDx presentations, download them straight away after this podcast. Wow, Nishin, can we start at the beginning? Wearable medical devices are not a new idea, are they?
Oh, no, absolutely not. So they started, I think the history goes back to 13th century when an Italian innovator designed the first eyeglasses. And of course, it is not a new story, it is not a new idea, but it changed a lot over time.
So I've heard you talk a little bit about the evolution of the pacemaker, and I think it's a great example of the journey of the wearable device. Can you take us through a little bit about that story?
Absolutely. I love that story. I think that story inspire a lot of researchers in my field to actually, to go through the pain of making devices after devices. So the story is about a Swedish guy, Arne Larsson. So he had a very weak heart and he was on stroke one after another, and he was always hospitalized. He didn't have a very good, he was a very passionate guy and he wanted to enjoy his life, but because of his heart, he had to stay in the hospital. I think it was in 1950s, and what the option he had was just a stationary device, which was not battery powered, and it's just an electrical connection to the wall to provide the power. And imagine that if there is a blackout, I think there was absolutely no hope for survival. But in 1958, he was brave enough to actually he went through a surgery. It was a voluntary surgery, and I think that they did it overnight when no one was in the hospital because they were not very sure if it works or not. So he was the first person in the history who ever had a tiny battery-powered device putting inside his body. It worked. Only for 3 hours. So after 3 hours, he had to go to another surgery, and they took that device out and they replaced it with another one. The second one worked for 1 week. So in his lifetime, he went through 26 operation and changed pacemakers that failed one after another for a wide range of reasons. But he actually, I think he was very brave, and I think we owe him a lot because the medical doctors who were doing the surgery, they learn a lot every time that they change some kind of functions of a device and then replace it with a new one. It is so funny. He died in 2001 at the age of 86, not from heart attack. He died from, I think, melanoma. He died from another disease. And right now we have around 600,000 pacemakers being used in people from the age of 5-year-old up to 100-year-old. And the pacemaker he used was, I don't recall in terms of the weight, but it was like you could hold it in your hand. But right now the pacemakers are so tiny, just like they work as a couple of grams, and they can last as long as I think 8 to 10 years without any need for a replacement. So, and all of this happened in less than 50 years. And you can imagine that how many lives Arne Larsson saved. I mean, his own life first. He actually outlived his own doctor. But you can actually imagine that one person's braveness and act of, being open to new technology, what a huge impact had on millions of people all around the world.
So you're an educator, so you now have to educate me. What is a nanoparticle?
Sure. Nanoparticle, by definition, is a very, very, very small particle which is too small that it doesn't even behave as a particle. Okay, let me explain it this way. So particles are usually solid. Okay,
Yes.
so they are in the solid phase. But if you make them so tiny, extremely small in the nanoscale, they might not behave as a solid anymore. They might behave as a gas. An example might be a tiny, tiny particle of dust that actually float in the air before settling on the table, because it doesn't really behave like a solid, because the solid material, if you drop it, the gravity has a very high impact on that material, on that object, and just pull it down. But if it's so tiny and if so light, then it might, like the air molecules might hit that nanoparticle, and the particle change its direction and stay floating in the air before sitting on the surface. In terms of size, if a particle is between 1 to 100 nanometer, we will consider it as a nanoparticle. And I also have to mention that 1 nanometer means 1 billionth of a meter. It's 5 atoms sitting end to end.
Okay, I'm on top of the nanoparticle. Now, the nanoparticle sounds a bit like a chameleon. You've suggested it can sometimes behave in different ways. What else does the nanoparticle bring to the table in terms of the sort of work that you're looking at doing? I don't know. It feels like it's allowed us to be smarter about some things.
Absolutely. Okay, so when you have the power of controlling such a tiny object, it gives you an opportunity to design new structures. And also it gives you an opportunity to even manipulate the property of the material. Let me give you an example. One example is the gold ring that is on your finger. And it is golden. People think that the color of the gold element is golden. But that is not true. It really depends on the size of the object. If I make a gold nanoparticle and if I make it down to 3 nanometer in size, my gold nanoparticle is 100% pure gold, but it is green. And then if I make it 5 nanometer, again, it is 100% pure gold, but it is purple.
Oh, I like this. Sound bad. Okay. Right. Okay, so bigger is not always better then?
Absolutely not. In my field, actually, smaller is better because smaller will give you an option to have multiple, for example, in sensing technology, if you create smaller sensors and you don't compromise the sensitivity, but you just make it smaller, then you might be able to have like 20 sensors on the tip of my fingertip, and that can give me an option of detecting multiple, for example, gases or multiple elements rather than using the entire room to put 20 sensors inside. So the smaller is better, of course, because it is lighter, it is cheaper, it is smarter, and I think it's faster.
So I want to be a nanotechnologist when I grow up is not something that I've heard out of a lot of teenagers' mouths. How did you get inspired to enter this field?
Sure. It's a very funny story. I think I was on my undergrad degree, and we were so obsessed about watching American series because we were trying to learn English. I'm from Iran, and in my country we speak Persian, and there is a very limited chance, at least 15 years ago, for someone like me to learn English and speak English very fluently. So one options, which was actually fun to do, was to watch American series. One of the American series I watched was Big Bang Theory. So it is about like a bunch of scientists which are socially awkward, but they are very brilliant. And in one of those episodes, Sheldon Cooper and one of the characters, he kept referring to the greatest physicist ever lived on the planet, Richard Feynman. I didn't know Richard Feynman back then, so I started Googling and reading about him. And then I got to watch one of the very famous lectures that he did in, I think it was in December 1959, if I'm right, and it was in University of California. And the title of his speech was, "There is plenty of room at the bottom." And then for the first time, he talked about in future, we're going to have nanotechnology. We will be able to print the entire library on the tip of a pencil. He mentioned that he doesn't know how, but he knows that one day we're going to write by atoms. And if we can do that, then we won't we never need any further, like more space to do that. We can actually print everything on the tip of the pencil, and that gives us a power. He started talking about the robots that can be as the size of a blood cell. Again, he said he doesn't know how people do that, but he was confident. And that, I think that was a very inspirational talk that got me interested in nanotechnology.
You found a tribe.
Yes, absolutely.
So what problems have you become motivated to solve?
Real world problems, like the big challenges. I think one of the main problems that we currently have is the healthcare system that we have, which I would call it sick care system, because the system is not designed to provide health at the first place. It is waiting for you to get sick first, and then it does the action. So the system waits for us to have the symptoms first, and the symptoms should be severe enough, and then we go and visit our GP, and then all the data collected by our GP is just based on that 1 hour visit that we have with the GP.
1 hour if we're lucky.
Exactly, yes. 1 hour if you're lucky. And then I did the math, so if you only visit your GP twice per year and 1 hour each time, so there are 8,700 hours per year that your symptoms, your body is not being monitored. And think about all these opportunities that we're actually losing here. So the in terms of a big picture, the challenge that we are really, me and my colleagues, which we're trying to solve, is to change the whole healthcare system to be more predictive rather than being reactive.
So you're currently working to design some super sensitive sensors, and these are containing the nanoparticles.
Yes.
And, I'm not an expert at this, so correct me when I get it wrong. And these super sensitive sensors are going to detect chemicals, which are going to tell us or give us hints as to whether we might be sick or becoming unwell. Am I sort of getting that right?
Absolutely. It is 100% correct. So the thing is, whenever there is something wrong in our body, what happens is that the chemistry of our body changes. But that change is usually so tiny that we're not really noticing it. So the beauty of these nanosensors is that they can be, because they're super sensitive, they can be sensitive to that tiny change in our body's chemistry. And if we can use them to pick up that change, then we might be able to actually have a very early detection of an abnormality in our body. And these sensors can be made of any nanomaterials, and they can be made of any nanostructure. Like nanoparticles are very commonly used to create these sensors, but they can even be nanowires, for example. They can be nanorods, they can be nano discs, for example. So in terms of the structure, they might be different, but they are, these days, they are all of them made in the nanoscale because, as I say, it gives us a lot of opportunity.
So what bodily fluids are you and people who are working in your field targeting with these sensors? And are some of our bodily fluids better at giving up our secrets than others?
That's a very good question. Traditionally, the body fluids used for disease monitoring or diagnostic, it was blood test and also urine. But these days, researchers are opening very new doors, I would say. Like the commonly body fluids people explore in research is tear. Tear analysis would be very easy to do, especially for people who are already wearing the contact lens. The sensor can be embedded into the contact lens and can do the like a real-time continuous monitoring of, for example, glucose. Of course, in your tear, it doesn't detect glucose, it detects another element which in reality, that one is relevant to what is the level of glucose in your body. But it's not only limited to tear. We can do saliva analysis. So you can have like a tiny tattoo stick to your teeth, and that can do and you can't even see that. It is there, and it does the saliva analysis. We can do sweat analysis. It might be a little bit challenging for people who don't sweat very frequently. And with the saliva, some people have a dry mouth, so they don't have enough saliva. That's why I am very keen to do breath analysis, because everyone breathes. If you don't, that would be a concern. But breath analysis is my own field of research, and any change that happens in your body, the composition of your breath change. And if we can pick up that change in your breath, we will be able to say that what is really happening in your body.
So just to clarify, are there different chemicals in the different bodily fluids?
Yes.
Or
absolutely.
Is what you're saying breath covers the whole gamut, or there's still a role for all of these different?
There's still a role for all
fluids.
Of those different. Of course, I have a bias towards breath.
Right.
I'm very aware of that. But for example, if you want to, let me give you this example. If you want to detect, like for diabetic patient, if you want to measure the level of glucose in their blood, you do the blood test, it is measuring glucose. You do the breath test, it is measuring ketones and acetones. And if you do the tear analysis, it's lactic acid, if I'm right. So it's another chemical. But all of those changes happen just because the level of sugar in your blood increasing.
And I mean, this is, just to make the obvious point, this is amazing because we're talking about patients no longer needing to do intrusive testing. So
absolutely.
No more pinprick tests for diabetic patients.
Exactly. No. It is, most of the new technologies introduced to the world is focused on being non-invasive. That's the whole point. It is focused on being easy for sampling, for example. Repeatability is always one of the factors that we consider, and of course, cheap price.
So that's reflecting sort of management of chronic illness, but we're also suggesting that there would be early warning signals in some of these bodily fluids around diagnoses and diseases that we don't even know we've got.
Yes,
so
absolutely.
Different again.
Yes,
okay.
for sure.
So what type of wearable devices housing these special sensors already exist, and what are the sort of promising new vehicles that you're looking at in your lab?
Yes, of course. So many of these new technology are still in the development phase, but I think we are already using a wide range of them. The common one is a pregnancy test. It is a wearable device. I would call it as a wearable device. It's a tiny device and it's picking an element in your body. The COVID-19 test, I think that is also a tiny chip. You don't need to go and do the invasive test. Drug test that police is using, alcohol test is exactly the same breath analysis that we are developing. It's just a level of concentration would be a little bit different. So with the alcohol, even our nose can smell if someone is drunk. But if someone has diabetes, then you can't really smell that. But the recent one, which they found the way to the market, is a ketone meter. They're still very careful of calling it as a device for diabetic patient. They just call it ketone meter, but it actually does the job. So you can actually buy it with a very reasonable price, and it does measure the alcohol. The breath. You can do the breath test, and it tells you what is the level of ketone in your blood. And very recently, I saw some sweat analysis test. So it's a pad that you can stick to your skin. The challenge that company has right now is to make sure that it is accurate, because people, even with different background and ethnicity, they have different composition of sweat.
Yeah. Okay. So those of us who are outside of the lab always just want to know, well, when do we get our hands on these things? When are these types of wearable devices going to become mainstream? Do you have a time frame that you can let us in on the secret? When can we get one?
Sure. I think it really depends on the type of the wearable devices. Some of them, like even if you look at the current one in the market, like a Fitbit or like Apple Watch, Samsung, they are wearable devices, but the regulatory approval for these type of devices, I would assume that is much easier than if the device is a medical grade device. Mm-hmm. So it really depends on the complexity of the device itself in terms of the accuracy and also the regulation about that. I think some of these devices would be available in the market much sooner than the other ones. For example, one example that I'm currently working on, and I've got the fellowship from Cancer Institute, NSW Cancer Institute, is a tiny device that can measure how much UV dosage is absorbed by your skin, because melanoma is the national cancer in Australia. That one, because it doesn't do sampling from your body, but it actually just gives you information. So it's measuring how long you've been exposed to what level of UV index and what is your skin type, and based on that, it tells you what is the limit, safe limit for your body. And then when you reach to that, like 80% of the safe level of UV absorption by your skin, you receive a text message on your phone that, it's better to seek shade. I would assume, and then we are in the stage of one stage before commercialization with the support from the NSW Cancer Institute. I would assume for that one, the regulatory approval would be much easier than the device, which is taking some samples from human body. But I wouldn't say, I think it wouldn't be very far. We are in a very, I think it's in a perfect timing to see all these new technology finding their ways to the market.
That's a politician's answer, isn't it? Yeah. Okay. So, I mean, in the same sort of vein, the people that bought the first Fitbits and Apple Watches, you had to lay out quite a bit of cash for those devices, and prices have started to come down as competitors enter the market. Will it be the same with these sorts of devices? Do you imagine they're going to be affordable for the average person?
Absolutely. It's exactly the same story, and I have a personal story about that. I started working on breath analysis like 8 years ago, and I couldn't afford to buy one of these alcohol tests because I really wanted to know that the concept I wanted to open it up and see what is happening inside in order to give me some idea on how to design my sensor. And it was really expensive. I remember it was around like $700. And as a student, I couldn't afford that. Right now, same device you can buy by $60. You can buy $60 and you don't feel guilty to open and have a look at inside. So it's going to be exactly the same story. I think the advancement in technology, it is so, these technologies are progressing so quickly that I think that is playing a significant role in reducing the cost of the manufacturing of those technologies.
Because one of the risks we would have to consider is the idea of accessibility, creating a sort of two-tiered health system that the wealthy can afford all of these tools and sort of live a more live in wellness, and other parts of society less so. But you're sort of suggesting that we're going to be moving fast enough that the price point's going to be reasonable, you think? I mean, this is difficult. I
think eventually, I think eventually we get there. But I do agree with you that there will be a time frame that we will have that two-tier healthcare system, that challenge, of course. But I think it really depends on the government, how they're gonna lead this new era. I think they can, government and also providers, I think they can, like for example, subsidize the advanced technologies for people who are low-income people, to make sure that the gap will be smaller and is managed. Every time the new technology found its way to the market, I think we will have that gap, that wealthier will be able to purchase it. But I think the technology is going so fast that it's not going to be, this gap for that particular technology, it won't be long. I think we will be able to have it way more affordable for most of the society.
Do you envisage that the products you're developing are going to be sort of something I buy off the shelf, or are these going to be technologies that are prescribed to particular risk groups? Mm-hmm. Are you thinking about that sort of end use case when you're developing?
Absolutely. Again, it depends on a product, and like two of the major projects that I am leading right now is the first one is SunWatch, a smart UV nanosensing watch for UV monitoring, real-time UV monitoring. I would say that one probably will be available for anyone to just purchase it. There is no need for a prescription about that. And the app, you just need to personalize it based on the app and choose what is your skin type, and that's it. You're good to go. But the other one for breath analysis, I think it is definitely will be like a medical grade device, and it should be prescribed by the medical doctor, because even with the breath analysis, we won't be able at this stage, maybe in future, but at this stage, we're not able to make one device that can pick any abnormality in your body. It really depends on the history of the patient. For example, if the patient has a history of being diabetes in their family, so they should be prescribed the breath analyzer that can pick, for example, ketones or acetone in your breath, and that device will not be useful for someone who has a history of lung cancer.
Okay. So, I mean, on some level, irrespective of how much these things cost, this wave of technology, it's sort of it can't be unaffordable to society, because the potential cost savings from this type of predictive healthcare and management of chronic disease outside of a hospital environment, without long hospitalizations and the rest. I mean, I can't see that it could ever be considered an unaffordable item. But I mean, you're talking about really a total game changer for medicine. I mean, I think we've talked a little bit about the breath analysis and its relationship with diabetes. I've been reading a little bit about this space, and I think others are working on certain elements that are relevant for cancer diagnoses, and even predicting cardiac health and heart attack. I mean, we're covering so much of where we spend our health dollar, as you say, in a reactive way. It's extraordinary. Do What do you imagine the impact on the health system as a whole looks like?
Absolutely. I think it's going to be like revolutionizing the healthcare system. And I totally agree with you. If you think about how much money we are paying, like the government is paying for this reactive healthcare that we have, it is not understandable how these new technologies could be unaffordable to public because the important role they're going to play in reducing the cost eventually, reducing the burden on our healthcare people, reducing the hospitalization time, increasing the life expectancy, because if you detect something so early, there's a much higher chance for you to be recovered from that. So I think if you think about that, again, this is something that I would say that it is government's decision and vision on how they can actually how they can see the future and how much they can invest on these new technologies. But I am confident in my heart that this will revolutionize the whole system, and I would say that it's better to get on with it as soon as possible because this is the future of medical health care.
Do you include patients in the design of your products? Do you think about patient sort of acceptance of this technology when you're doing your work in your lab? I'm interested at what level of consultation there is with sort of the end user.
Yes, absolutely. You must consider the end user because these are the consumers. These are the people you are like you're doing everything for that group of people, and if they are not really satisfied or they're not very welcoming toward using your product, I think this can be considered as a big failure. Again, I can give you an example about the UV sensing that we are currently working on. Initially, we had it as a watch around your wrist, and it was working very well. But then just among my own team, we made multiple versions of that, and I asked my students to wear it, and then I received feedback from them, and I realized that the main feedback is that they already have a watch. They don't want to have another watch to detect UV for them, and some people they don't really want to have a watch, and they don't want to have it just wear a watch because they want to detect UV. So current project for the next 3 years, we're working to make it as a tiny like a pin, like a clippable pin that you can actually clip it everywhere. You can clip it to your jacket, you can clip it to your sunglasses, you can clip it to your hat. So we try to make it more acceptable, for a wide range of people, regardless of their age, regardless of their gender. But I think, absolutely, the acceptance from the end user is definitely one of the important factors need to be considered.
Do you think ever about sort of the issue of trust? I think that a lot of people have suspicion around technology, and now we're potentially asking people to pop something on their tooth or in their eye. I imagine, some people will find it challenging or maybe intrusive. Where is this information going? How is it being used? Have you come across that sort of feedback as well?
Absolutely. But I think it is double-sided. It actually depends on how you look at that technology. Of course, every time in the whole history we had a new technology, even calculator, like when calculator was introduced into the world. I remember that I was reading an article in 1988, I think, math teachers in US, they went to the protest and they said that calculator is destroying your brain because it does the calculation for you. I think this is not, it's always the case. However, I think in terms of the wearable technologies, I always use this example of the data collected by this technology will eventually do well for you, because when you sit in your 1 hour visit with your GP, the decision that the GP makes about what pill or what medicine is good for you is not just simply because they've done 5 tests in the past 1 hour and they just go through that 5 tests. It's based on that 8,700 hours of data detection with your wearable device. So I think the decision will be way more accurate, I think, and way more personalized, because again, people with different biology, body biology, or different background, they might react to different medicines in a very different way. Like, for example, me and you, we both use the same pill for our headache that our brothers or fathers are using, but we know that women's body is not just men's body in a smaller version. It's actually a different biology. So the medicine we take have very two different impact on my body than my brother's body. And I think, how can I know what is the impact? These wearable technologies will be able to collect data in real time and hopefully help the GP to make a better decision for me.
I mean, that's a very good segue, because I wanted to talk to you a little bit about what is it going to mean for doctors. Are we going to need to be trained in a different way? Are we going to need to be better data scientists ourselves? Are we? How do you feel this might change the role of the clinical doctor into the future?
I think we still need them as much as we need them right now, because these technologies, they only collect data. They cannot interpret the data the way that a medical doctor who has years of experience in studying medicine and also in practicing medicine has. So these technologies are actually, I look at it this way, that they are helping our doctors, medical doctors, to make a better decision for us. But in terms of the communication between a patient and the doctor, these technologies are useless in terms of the interpretation, even in terms of the prescription of what medicine is required based on this collected data. These are just the support tools, the helping tools to help us to have a better healthcare system. We definitely need our doctors as much as we need them right now.
I'm going to ask you a curly question now, and it's not really a fair question to ask, but it's an interesting question to think about. I mean, the world that you're giving us here today is one where we're going to have a sort of previously unimagined level of knowledge and control over our own health and well-being. But, you know, look, we already know things like we know that smoking is bad for us, and yet people still smoke. So is there a risk that despite these extraordinary opportunities for a healthier world, healthier society, that we're going to squander our opportunity just through that sort of human resistance to behaviour change? And do you worry about whether you'll be able to realise your dream? You're going to hand us these devices, but are we going to use them responsibly and make good decisions so that we really can create this world of wellness, the health system rather than the sick system that you talk of?
Absolutely. I think it's a very complex topic to discuss, because I think human being is a very complex creature, and of course, we always have that resistance from people to change behavior. But I'm an optimistic person, and I prefer to stay optimistic. I think with the advancement of the technology and the next the young generation that we have right now, I think they are way more welcoming to accepting this technology, because this is how they see the world. This is how they nurtured, and this is how they from the very early age in their childhood, they get to get connected to the whole world using this technology, and they can see that of course there's always the pros and cons, but they can actually find their way to use these technologies to their own benefit. So I am more optimistic about future, that we probably have less challenge compared to what we have right now. I think this era is a transition era, that people are very skeptical about everything, which that makes sense, but I think in the near future people will be very more welcoming. However, we're talking about we are talking about there's always a group of people who will be against all these technologies. We still have people, very educated people, they are against vaccine. We still have people who believe that the planet Earth is flat. So I think we always have that category of people. But in terms of the average, in terms of the majority, I'm very optimistic that this new generation and their familiarity and the frequency that they being introduced to a new technology and a new device would actually help us to, have a better acceptance from the society.
Dr. Nasiri, it's a pleasure to have met you. I'm absolutely I'm going to go and read a lot more about nanotechnology. And I think all of us need to be on this journey with you and be optimistic that this is the future that we're looking forward to. Thank you for the work that you're doing.
Thank you so much for having me.
Go ahead and like, share, or subscribe now so you don't miss a thing.